we're trying to get on top of here with this second generation strategy is keeping up with these changes. It was a fight against the people dying young back in the 90s, and now it's about it's a fight to keep people alive long term nowadays and keep people functioning well. So that's how we've generated this plan. It's taken us over 2 years to get here, and we see another 3 years coming up where we're going to have to actually see these changes come into effect. And we're going to talk about those changes today, and if we've hit the mark, or if there's stuff that you see as stuff you're really excited about, things that you are concerned about, that you think you got to be really careful if you're going to do that, things that just don't make sense to you, and that we need to do a better job of articulating. What are we actually talking about there? Tie into this. So one of them is involve our clients to improve our services. There's 2 bits in that club. Have peer support available in all downtown Eastside health services. And the other one is create more and ongoing opportunities for clients to give their input and share their concerns about health services. 2 things we want to do there. Next one, enhance harm reduction. And that involves 7 different things. So I will walk you through those. First, work towards having supervised injection available at all VCH sites in the downtown east side. So health center, mental health team, whatever, have supervised injection options there. Second, make harm reduction part of all our services and the services we fund in the downtown east side. Improve the way that harm reduction services connect people with treatment. Okay. 3, train all of our healthcare staff in naloxone and overdose prevention. Like Narcan, that's the stuff you give someone when they have an opioid overdose, and reverse effect. And number 4, support research into prescription treatments for stimulant addiction. So right now we don't have an option for that, and this would be seeking that. 5, look at expanding harm reduction support services for people with serious alcoholism and people who drink non-beverage alcohol, like mouthwash or hand sanitizer. This is about that alcohol harm reduction. Number 6, install TVs that show drug alerts in key places around the neighborhood. You've got hot heroin, you've got lots of contaminants. And number 7, make it easier for anyone in opiate withdrawal to get single-dose methadone when they need it, along with other health services at a low-barrier place like a drop. So someone's in withdrawal, 1 shot of methadone to get them through that withdrawal. So this will take a long time to walk through this. I think we might do this sort of one by one. Affordable, free food more available. Make the housing we fund better at supporting tenants with unique needs. Specialized supported housing. Help people get care when and where they need it. That's about times it's available, locations, things like that. And make healthcare feel safer with staff to better understand where people are coming from. So that's our clubs, 8 of them. We're going to go through the details as we move forward, but that's just to give you a sense of where we're headed. How we're going to do that together. Set standards for the quality of food served by the programs that VCH funds, and use research to see if it actually helps people's health. Help people to cook for themselves in community kitchens. All right. Next, fill important health service gaps for people who are struggling with difficult transitions. First one, create a new place for people who are homeless to stay when they leave the hospital and help connect them to more support while they're healing. Second one, improve the way we support youth who are becoming adults and getting too old for youth services. So they have to bridge from one system to another. Make healthcare feel safer with staff to better understand where people are coming from and what they need. So this is 4 points. First, train staff in how to work better with Aboriginal clients, women who work in the sex trade, people who have experienced trauma, and so on. Second one, require all the agencies VCH funds to be safe for women, young people, LGBT, and Aboriginal people. Third one, create new dedicated women's health services. And the fourth one, help agencies that are meant for adults but have youth using their services too to better support those youth. Okay. On here, help people get the care they need when and where they need it. This says make the clinics open longer and open insight earlier in the day. Have VCH outreach teams go into any hotel where people need it, not just VCH funded hotels. So right now, those medical outreach teams, they only go to certain hotels. This would be opening it up to wherever people are that need that kind of support. Make drop-ins an easy place for people to connect to the medical care they need. Set up mobile clinics for women in places around the neighborhood where women spend time. Start looking at how to improve the way we treat people for chronic pain. And number 6, get agencies working together to improve the way we care for people who are dying. And 2 more posters. Make it easier to find the right health care. 3 points. Number 1, put addiction services, mental health services, home health, and health clinics into one building. Number 2, for people who are using more than one health service, one health staff member will be responsible for making sure all the other healthcare providers are working together. That means that
look at us working together.
Yes.
Yeah. Already happening.
And so that one means that if you're seeing a whole bunch of different healthcare providers, one person knows what's going on, and they're coordinating that everything's sort of working together. Number 3, make a map of all the services for children or families in the downtown side. Make a list that families can use to find what they need. Right. One last poster. Housing. Make the housing that we fund and supporting tenants with their unique health needs. And so 2 points. Give people the choice to have their tenants and floor workers work more closely with their healthcare team, so that person can be supportive as part of all the healthcare stuff you need. And then 2, make health-funded housing tailored to people who need special supports. For example, brain injury and things like that have certain special needs associated with it. So that's what's in the paper.